Hey, this is Carrie from Wrap Your Head Around the Silks. This is the Expecting Aerials podcast, now part of the Digitint family podcast. How you guys doing? I hope your December is going well. Before we get started, in the show notes, there's links to sign up for Roll It Out, live 60-minute virtual myofascial release class. So just you on your floor with your balls and foam rollers, and we get into it every Sunday night, 7 p.m. Pacific time. And there's a student portal. You can log in, take the class as many times as you want that week. 14-day free trial. You guys, I have videos on there, 10 to 15 minute focused on a body part. You can do anytime you want, 24/7 access. Also, I have the free 3-part video series for aerial rehab back on the website. So if you have not seen that 3-part masterclass series designed for you coming back to your practice after you've done PT, and it's that bridge from PT back to class and feeling like you can invert again, etc. So that's on the site. You can check in there. And today we have my favorite OBGYN in the entire world, Dr. Janae Davis. And you guys might have heard her at the beginning of this season because I had her break down how she performs a C-section. Today, we are talking about how she performs somebody's tube tie, and then also all the things to think about around it. I knew none of it. I feel very educated now on the subject, and I laughed for an hour while she talked about it. So this is such a treat because she's hilarious. If she was my teacher, I might have gone into medicine as well because she's so engaging. All right, guys, let's get started. Listeners, this is Dr. Janae.
Hi. Hey.
She's been here before. And she started out season 2, which was at the beginning of 2022. And she is, although I didn't know her back then, because you weren't raised in Newark, Heath.
No, I'm a newbie.
Yeah. We're from, she lives and works in the same town and the same hospital that my dad worked at until he retired. So yeah, right. That's how Correct. I feel. I feel like I lived in the parking lot while we were waiting for him for something quick, Correct. Quote unquote. But he's no longer a doctor. But so Janae is obstetrician there, and she, I wish she was my doctor, but she's Kelly McVeigh's doctor, and Kelly and I do Greener Grass, the other podcast. The last time Janae was on, we talked all about what exactly happens during a C-section. I had so many women be like, I had no idea. I have had one and I had no idea. So I wanted her to come on today, and I asked her for the very also mystery topic of getting tubes tied, how this happens.
Yep, I got more for you. Mm-hmm.
Dr. Janae, how many of these surgeries have you done in your life, do you think?
Oh my God, thousands. Literally thousands. Thousands. Mm-hmm. Well, I've been doing this for 20 years. I got myself worked up because I graduated I graduated med school in 2002. So I was like, oh my gosh, this is 20 years of doing OB. So I had a little bit of a moment. I ate a lot of Witz ice cream over Witz frozen custard for about 2 days. Now I'm over it. But yeah, I mean thousands. I did 8 C-sections in one day during residency. So it's just not even fathomable to even consider how many I've done. It's ridiculous.
Okay, so let's talk about, Can you talk about the scenarios in which you have performed?
Heck yeah. Well, here's the thing. So I think that one thing that's confusing for people, or not confusing for people, but I always tell people, listen, guys, like back in like the 20s when we had like a Model T car and everybody thought that was great because you didn't have to like load horses up and like pick up poop and get hay, like because you could get from point A to point B in about 2 miles an hour. And we thought that was really great. But now in 2022, we have electric cars. We're zooming all over the place. We have trains, we have planes. That is as different as permanent sterilization stuff happened from before till now. So back in the olden days where people say, I'm in here to get my tube tied. It's the only thing that in their mind they think of having permanent, I'm air quoting, permanent sterilization is getting their tubes tied because their grandmothers only knew to get their tubes tied, or their aunts and moms only knew to get their tubes tied. Whereas just like we do not drive a Model T around anymore because we have electric cars, there's so many other options that people have that are as equivalent to getting your stomach cut open and having permanent sterilization that people's consents are inappropriate. And that's probably what I want to talk about. Maybe I don't want to say the most, but even more so that's important in the procedure is that do you really know what you're talking about when you're talking about getting yourself sterilized? First thing, who is it who wants to be sterilized? If you had triplets or anything close to a screaming colic baby, about everybody wants their tube tied right that minute, right? Because this is some shenanigans. I'm like, who's signed up for this? I'll tell you who else. The people who have them perfect first babies. Oh my gosh, my baby is so wonderful. I'm like, And then they get that second real baby, like the baby like every the rest of us got. And they're like, I want my tube tied right now. I'm like, I know, Janice, just give it a second, girl, because I know it's rough right now. We're all tired, but no. So the people who think about wanting to get their tubes tied, it's a lot of it is life circumstances. So when we counsel a person traditionally, which is super, super arrogant of the obstetrics community, we would counsel people based on our personal thoughts about whether they should be having babies or not having babies, or if they were too young to make a decision about it, or if their partnerships were appropriate, or, you got divorced, so you don't know what you're talking about yet, and all these things. So when we counsel a patient, we really need to work in the medical community about doing that in a really as non-biased way as possible, or be at least transparent about the fact that we used to think that we knew best for people, but we really don't. We have to honor where they're at in their life and what they're doing. So the things that will influence whether or not somebody can get their tubes tied would be age. So if you are under some type of federal government insurance, it is essentially not going to get paid for below 21 years of age.
Okay.
Right? So you have to sign a consent once you get to be 21 years of age that is signed greater than 30 days from when you decided to get your tubes tied and less than 180 days or 6 months when you want to get that done. So anybody who comes to my clinic who is even remotely considering having permanent sterilization, I will sign this consent with them around 28 weeks or so, just so that it's on the books in case they decide they want to do that. Who else wants to do it? How many other kids do they have? Like some people, hey, I have 4 kids. It doesn't matter. Even if they all died in a fire, I would never want to birth another child ever again the rest of my life. Okay. You know what I mean? We have that conversation. Some people have 1 child and they say, even if I lost my child, I would rather adopt a baby. We honor that for people. And honestly, there's a really low association of regret with people who've never had a baby before. If you never had a baby before, decided that's not what you want for your life, and you want to have permanent sterilization, that regret rate is lower than somebody who has 3 children, honestly, because that person has decided in their mind what they're doing with their life, which is totally fine. If you're over 21, socially, we say, you don't know what you're talking about, blah, blah, blah. And I always tell people when I'm consenting them, it's not that I want you to have more children if you want your tubes tied at 21. I'm not telling you that when you're 24, you should have 6 children. What I'm saying is that 10 years ago, when you were 11 years old, if I asked you what it is you would like for your life at 21, and I let your 11-year-old self make a decision for yourself at 21, you probably wouldn't be too happy with where you're sitting. Same thing when you're 21. When you're 21, you're making a decision for your 31-year-old self and your 41-year-old self, because essentially your reproductive life is from like 20 to 40 for most people-ish. That's the rest of your life, doubling your life, where you can have different experiences of different partners, tragedies. You came into a lot of money because right now I can't afford it, but then somebody's life circumstances change. When people start saying things about, it's just, my mom doesn't want to watch any more of my kids. Well, that's a life circumstance situation that might not have as much to do with the person and how they feel about what they should be doing with their reproduction. So those really, really digging in, like, why are we doing this, girlfriend? And if you want to, totally fine, but making sure that it's a decision that they are making and that their family members aren't making for them, or that they just feel that they're not in the right position to do, because we are not driving Model Ts around anymore. And we can get you as close to permanent sterilization with a reversible contraception now that gives you the option to not get pregnant, as well as having your tubes tied without having to have something permanent done to yourself. So that's why the rates of tubal actually are going down over the years, is because people don't have to do that, but can have as good of birth control as if they had gotten their tubes tied. So that was probably me just going off on my little half tangent.
No, that's
because it makes me mad.
Yeah. Well, and then also the vasectomy is reversible.
You don't even want to talk to me about a vasectomy. So here's the thing. So if you're in a relationship, that is what the partners feel is permanent, then 1,000,000,000%, we're talking about opening up somebody's abdomen into their peritoneal space, which we can go all into that later. But it is a non-anesthetic procedure that is done in the office with a little shot of a little bit of lidocaine. The recovery is extremely quick. The risks are extremely low, including minimal bleeding, extremely low risk of infection. Put a bag of frozen corn on your little ball sack. You're going to be totally fine after a couple of days. Okay. To calm down, do it during March Madness if you really want that time off work. Okay. So just the conversation that people are like, he won't do it. He won't do it. He won't do it. They come in and have this thing of he won't do it. And I just think to myself, and don't get me started about recent events, like why the entire weight of reproduction has to fall on females right now. I just really get aggravated thinking about it. And actually, just FYI, there's this new called like vasogel or something that's being tested right now. It's a reversible hydrogel that is put in the vas deferens that dissolves over time. That would be the first semi-permanent birth control for men that is on the market. So a bunch of people are looking at some stuff to try to give guys a little more onus in the when am I getting ready to get somebody pregnant? Right. But don't even start. So yeah, only about 8.2% of people who are having permanent birth control in their relationship are relying on vasectomy, which is ridiculous to me. It's just hot mess ridiculous. I just have no idea. So yes, if somebody's in a relationship that is of permanence, then great. But there's a lot of people in relationships that are not permanent. Mm-hmm. So what does that mean? I'm in an open relationship. I don't like him very much. So I may be doing some other adult things that I don't want to discuss with somebody else. None of my business, So people sometimes want to make sure that they are the ones that are in control of that in case they're in relationships outside of the one that is traditional for them.
Oh, Dr. Janae, I love having you on this podcast.
Yeah, let's get it. Listen, I'm here for it, girl. I'm here for it.
Okay. So you answered one question for me. Getting your tubes tied in 2022, it's still not a situation where you do laparoscopic, blah, blah, blah. It's a full opening up, exposure to the uterus, everything.
No, we can do it laparoscopically.
Oh, okay.
We can do it with poke holes. So there's a whole bunch of different ways to do it. In America here, we do it in really non-invasive ways, but in other places in the world that don't have the same type of resources we have, there's some kind of more barbaric ways to do it. So yes, they open their stomach all the way up because they might not have the equipment to be able to do it laparoscopically where we do it with little poke holes. So laparoscopically means, hey, I'm going to just take a little poke hole and poke right through your belly button with something about the size of a drinking straw or a little bit bigger, and put a camera through there and blow your belly up with gas. So it's like a balloon and I'm just looking down at your uterus and fallopian tubes. Then I can put one or two more poke holes down at kind of in the bottom corners, a little bit inside from your hips, and put two more little pencil holes in there and kind of just cut your tubes out like that. That's laparoscopically. There's a postpartum tubal, which you had a vaginal delivery. After you had a vaginal delivery where your whole belly was like all the way up to your freaking feels like your throat, but it's not. After your uterus is that big and the baby comes out, once that uterus shrinks down in about 24 to 48 hours, the uterus is still about the level of your belly button. So because your uterus is about the level of your belly button, if I put a little incision below your belly button, I can actually get to your fallopian tubes without having to put poke holes in there. Right after you have a baby, within 6 weeks of having a baby, you have increased risk of aspiration if I put you to sleep. If I put you all the way to sleep to blow your belly up with gas, which is what I need to do to do it laparoscopically, then you could throw up because you just had a baby and all of those hormones make it so your stomach doesn't tolerate that very well. And then you could suck that vomit back down into your lungs and get aspiration pneumonia, which is a really big deal. We've lost moms with aspiration pneumonia before. So right after you have a baby, no anesthesia person is interested in putting you to sleep. So we do a postpartum tubal where we make that little semicircle underneath your belly button that's probably about 2 centimeters long, and we can get to your tubes that way. If I'm doing a C-section on you, I have your whole belly, which we talked about, Diva. Oh yeah, girl. Took pictures of it and everything, girl. You should post them pictures of them tubes again. I think I sent them over there.
Yeah, I posted them.
Yeah, girl. So if I'm opening your whole stomach open and I'm literally holding onto your uterus, oh my gosh, this is super 2 seconds. I'm just zip. I'm going to take your tubes out because I'm staring at them. So I'm not causing you any undue harm because I've already done that. And then there's a hysteroscopic tubal occlusion, which, because I'm so old, was amazing. Those were amazing. That meant, hey, sis, you don't want me to poke in your belly and blow your belly up with gas? No worries. I'm just going to go in through your vagina with a camera, look inside your uterus where the baby would normally be, find the holes on both corners where your fallopian tubes come into your uterus, and I'm going to plug those holes up with something. I'm going to plug them up with a coil, which was called an Essure, or I'm going to plug them up with a little piece that looks like a little grain of rice, and I think it was called an Adiana. They were amazing. There was no incision. There was minimal risk to the patient. There was minimal bleeding. There was some people don't do them anymore, so they took them off the market, not because they caused so much trouble, even though there were some articles that came out and some people making some flubbubs about post-tubal syndrome. But that really wasn't the reason it came off the market. It was really just because people had other options they wanted to use better. But it was incredible. And when I did it, it was, you just stood up and go about your day and didn't have incisions on your belly. So okay. It was great.
This is all new news to me. All of it. Okay. So question, with the little rice grain plugging the fallopian tubes, why would that not be reversible?
It's not reversible because it was scarred, because by putting something that's irritating, let me think, what can I think of? Your fallopian tubes are even smaller than the little tiny hole in a coffee stirrer. Okay. Right? It's even smaller than that. So when I take a piece of rice and I put that into that really soft, sensitive tissue that has little tiny wispy hair-like delicate little nose hairs.
I wish the listeners could see your hands right now.
Yeah. I'm like, yes, they are carrying so gently with such reverence, carrying this egg down the fallopian tube to meet this one sperm of the million to try to procreate. Okay. That right there, that amount of delicate reverence that we give to that tube, if you shoved a jagged piece of rice in there, it's like putting concrete in there. It is going to scar down around that area because it's so irritating to that delicate, tiny fallopian tube that it scars it shut, period. You can't just cut that and reattach it because it is that's microsurgery. It's happening at the level of the actual uterus instead of down the fallopian tube where we can kind of give ourselves some grace. When it's literally into the muscle of the uterus, you're a done deal. Now, that doesn't mean you can never get pregnant again. It means you're probably going to have to do IVF, right? Somebody's going to have to go in there and get your eggs out, put them in a jar with some sperm, and then shoot them back into your uterus to bypass the fallopian tubes.
So and that's the case for any woman who has their tubes tied.
Incorrect. So if you have your tubes tied in the traditional old school way, which was, hey, my fallopian tubes may be 3 to 5 inches long, right? We used to, back in the old days, say, Janice doesn't really know what she's talking about. You know what I'm going to do? I'm not going to mess the tube up real bad. I'm just going to put a staple across it. Okay, great. It was called a Filshie clip or some other things. We would just staple it. So we caused minimal damage to that tube, except right where the staple was. So we could go and reverse that later because it was in the middle of the tube, not at the muscle of the uterus, but in the middle of the tube. We would cut out the staple, and then with little tiny, we put these goggles on with little tiny micro goggles. We were like, okay, y'all. And we would micro.
You guys cannot see her, but she is doing some crazy shit with her hands. And
yeah, I was like, my little hair suture. We'd tie it together, and we'd be like, and we'd pray across it. Please, Lord, just get these tubes back together. And then we would shoot dye through it to make sure that it was open. And we'd say, okay, that was your tubal reversal. We could do that even if we, like the pictures that I showed you during a cesarean section, even if I took a hunk out of your tube, like a little hunk, I still would leave myself enough on both ends that I possibly could re-anastomose, reattach those two together. Nowadays, we remove, or most of the time, we remove the entire fallopian tube because there are some studies that are showing us that some ovarian cancers, or that we thought were ovarian cancers, which for white women in America is about 1 in 70 lifetime risk for ovarian cancer. There's some that we thought that were ovarian cancer that truly originated in the fallopian tube. And so if we are going to be right next to these tubes anyway, there's no hormones in this tube. It doesn't do anything for our ovaries. Why don't we just remove that to decrease the risk of ovarian cancer or potential primary peritoneal cancer for women? So now typically when we do a tubal, we know you 100% do not want to have any more children, or we shouldn't freaking be doing it. We're not stapling because you're going to change your mind later or do any of that stuff. We just take the entire fallopian tube out now.
Okay. That's what I was going to ask. Like, let's just say there's a staple, or there's that little bit of like sized rice. Where do the eggs go? Because they're getting shot through the tube still monthly.
No. So here's the trick. You know what? And I'm all about one of them feministy t-shirts that shows me my flowered uterus with the fallopian tubes hanging out with the flowers on the end of it, my ovaries, but they're really not attached. Really, they should draw it with a couple of ovaries, and hanging over here are 2 fallopian tubes. They're not really attached to each other. So that egg, every single month that you shoot an egg off of your ovary, it really falls down behind your uterus. It falls down behind your uterus. Correct. Here we go. You're welcome. You're welcome, Carrie. Wait, let's talk it through, girl. Let's talk it through. Okay. So your body every month decides it is going to pick 1 egg to select, or 2, sometimes 3, Lord have mercy, 1 or 2 or 3, most of the time 1 egg that it wants to select to potentially get you pregnant that month. Your ovaries on both sides do not continually alternate, 1 left, 1 right, 1 left. It doesn't always do that, but eventually it kind of evens out. So you might have a couple on the right side, a couple on the left side, a couple months, and then, alternate for a little while. But what you need to know about your ovary is, and I explain this to my patients, if you took a tennis ball, you can pretend a tennis ball is your ovary. And then if you took a piece of saran wrap, think about just a sheet of saran wrap, and you took pepper and you sprinkled pepper on your saran wrap. If you went to pick up your piece of saran wrap, none of that pepper will move, right? It's just sprinkled on there because it's stuck, because it's saran wrap. Does that make sense? Okay, so then I take that piece of saran wrap that has pepper on it, and I wrap it all the way around my tennis ball. That's what an ovary is like. The pieces of pepper are your eggs. There are no eggs in the middle of your ovary. The only thing that's in the middle of your ovary is a bunch of blood vessels and connective tissue and stuff like that. Your eggs are only on the very outer layer of your ovary. But how in the hell am I supposed to get 1 egg per month, this little tiny piece of pepper, off of my ovary? Like, how's that supposed to happen? Because we're so amazing. Okay. The woman's body says, mother blanks, I'm going to pick this particular egg, the best one that I got, and I'm going to start secreting a hormone that makes a blister form around this 1 piece of pepper. So every single month that you are ovulating, that 1 piece of pepper is selected. It starts secreting a hormone that puts a blister on the outside of my ovary. And that blister gets bigger and bigger and bigger and bigger and bigger through the month until it's about 3 to 5 centimeters. And it has 1 piece of pepper floating around in a bubble of fluid. It's an ovarian cyst. It's a follicular cyst. It is completely normal and natural. And then it goes and it bursts, and all that fluid falls down with that 1 piece of pepper behind the uterus. And a little cup down there called the cul-de-sac. You don't care about that. Anyway, then all of a sudden our little fallopian tubes are like, oh, I think an egg popped out of here. So both fallopian tubes go down with their delicate little hair, butterfly eyelash hairs, and just say, oh, please, Lord, let me try to just absorb and pull up this fluid in hopes that an egg is in that fluid and will travel down this fallopian tube. So you can have a right ovary and no fallopian tube on the right, and a left fallopian tube and no ovary on the left, and still get pregnant, because the ovary releases an egg on the right the fluid falls down behind the uterus and the left fallopian tube could go down there and pick it up. Does that mean they're not attached to each other? It's a trick. It's because the picture looks better.
My mind is so blown right now.
It's blown, Carrie. I know it, girl. Go back and look at that picture. When you look at when I picked up that tube, it's not on the ovary. You don't even see it on the ovary. I know, girl. Girl, you should have seen me in med school. I was like, hold it, y'all. Where's the camera here? I know y'all lying.
Oh my God. I wish if you were my biology teacher, I might be a doctor today because I would have.
Girl, I'm serious. I want to be, but I'm like, y'all ain't gonna believe this. You are. I would be so
much more engaged in class if you were my teacher. Have you ever thought of doing that later?
I did think about it, but I'm being honest, I don't get along as well with that age group of kiddos. They wear like Act body spray to like spray over top of like BO instead of taking a shower.
You mean like college age kids?
No. Oh, I thought.
No, it doesn't matter. Like teaching in medical school. Have you ever thought about that?
Well, I did, but then, I don't know. I just wasn't done doing all this good clinical work yet. So I hadn't really gone there yet.
This is so left field, but somebody who's an MD, do they have to go and get their PhD before they can teach?
No.
Oh.
You have to get like a teaching certificate, but you could go teach.
Dr. Janae, when you're all done with your clinical stuff, I vote for you becoming a university professor.
Well, we'll talk about that in like 4 or 5. Let's see, how old's my kid? I need 7 years.
It's okay. And then I'm going to be like, I'm quitting everything. I'm going to medical school. Wait, you don't have any of the prerequisites. Oh, shit. That'll be my answer.
Right. It's okay. It's all right. But I tell people this story when they come to see me because what is important for all your listeners to know is it is completely normal for you to get a cyst every month. I swear to God, if I have one more ER follow-up for I had a cyst, they're like, I had a cyst. I'm like, you ovulated. Congratulations. Like, that is not a problem. Like, they hurt like a mother blanker sometimes. If when that burst, it hits a blood vessel and you bleed a little bit, it feels like somebody might have stabbed you in your stomach. But if you're not on a suppressive birth control, a birth control that you take by mouth or get stabbed into your body to trick your body into thinking that you're already pregnant, like a birth control pill, a Depo-Provera shot, a rod that goes in your arm. If you're not on one of those, then your body every month is going to make a 3 to 5 centimeter cyst so that it can try and get pregnant, period. It is not an emergency. So when people are like, I need you to do surgery, I'm like, we just rescan you in 6 weeks and it's gone.
Okay. So how is that different from like a fibroid cyst?
So a fibroid is completely different. So a follicular cyst is my body selected this egg hormonally to produce fluid to burst an egg to be able to come through my fallopian tube. A fibroid is sitting inside the muscle of your uterus. These are completely separate spaces. The uterus has like a little firm tennis ball in my uterus that is a benign tumor that once it's decided to be a fibroid is always a fibroid. Probably 35 to 40% of people have a fibroid. And you can have a fibroid that's half a centimeter. You can have a 5 or 6 centimeter fibroid. It just depends. And depends on where it is in your body. They don't typically hurt people. They're incidental findings most of the time, unless it is encroaching into the lining of your uterus where you bleed. And then it causes people sometimes to have heavy bleeding. Also, if you have big fibroids, it can cause reproductive problems for you. Like if you're trying to implant a embryo into a fibroid, that doesn't work very well, and it causes recurrent miscarriages for some people. There's a bunch of different things, but it's more prevalent in African Americans than not. But yeah, they're pretty common, but they're completely separate space.
So you're telling me, like, why am I my age now? And this is the first time I'm learning that you basically create a cyst every single time you ovulate.
Every single month.
So
you ovulate.
So when people, I got my eggs frozen when I was 38, right after I got divorced. Okay. I didn't know what my future was. Okay. I got them frozen. And one of the things that my doctor had said was, you're getting too many cysts on your ovaries. We can't
trigger you.
Yes. We can't trigger the IVF because it wouldn't be beneficial to your IVF cycle. So, So in that case, I had many, right?
Too many. And they might not have been all mature. So it depends on the size of them. So say I hyperstim a person, I give them medication with a shot to make their ovaries, it's an anti-estrogen to make you think you don't have any estrogen so that you'll reproduce a whole bunch of eggs so that I can go with this straw up your vagina and suck out these eggs, which hurts like a mother blanket, which youcherama. So if there are too many and I give you a shot and you release all that all at one time, you can have hyperstimulation syndrome, which I'm not sure if that's what happened with you, but you can cause peritonitis inside your abdomen. Like if you have too much hyperstimulation, you can get an influx of fluid into your abdomen to fight that off. We've had to like tap a person for like 2 liters of fluid off their belly before. Like you can have a problem for a person who over responds to the medication and it's not safe. Second, depending on you could have some cysts that are only partially formed. They're not the good ones. They're only like excited, but not like ready to go. So you have a whole bunch of excited, but not enough good. So if I trigger you, you're only going to get 2 good ones when really I want to try to get 6 or 8, right? So maybe this cycle didn't respond as well for you. So I don't want to waste the trigger and go in there and make you have to do another retrieval. So I don't know exactly which of those scenarios it was, but those are 2 reasons why we might not trigger a person.
Okay, so in my body right now, there could be like on my ovaries, a couple different cysts that are like excited and hormonally stimulated to release.
There could be, but usually there's only 1 a month.
Okay. Oh my God. My mind is... And
we're born, by the way, with every egg we'll ever get. That's why the older a person gets, we get more funkety about like, oh, because a 40-year-old has 40-year-old eggs and a 20-year-old has 20-year-old eggs. When we are born from our moms, we have 100,000 eggs. When you were inside your mom's body, when you were 20 weeks, you had 2 million eggs on your ovaries when you were an embryo. But they just die off. They die off. They die off. We're born. They die off. They die off. We start having periods. We got, I don't even know how many thousands. And then by the time we hit 40, there's even less and less. So our body is picking the best one every month. And now I'm here getting down to the, these are not as good as they were when they were 20. They're getting to the bottom of the barrel. Dang it. That's why we end up, girl. Is this what we got? This what we got? So then that's why our chances for having anomalies increases with age. But men don't have that because they reproduce sperm every blame day, girl. I mean, can I have another hour on why the mother health do they not run out of wanting to effing have sex every minute of the day? That is a whole nother talk about the lions in Savannah, like we talked about, walking around. Y'all ready? They got to be ready all the time. Women only need to be ready when we're in heat. That's why men produce all the time and women don't. But that's a whole other story. I could talk for 2 hours on that. And what is typical for coitus timing and what isn't? And get over it. Whoever was reading Cosmo magazine, because that's some BS. Ain't nobody having sex that often. Okay.
Only with you do I not ask any like interview style questions. The question always starts with, wait.
On this little aside, you can cut this out. You can cut this part out if you want to. But I was doing this. I had a 25-year-old came in to talk to me about infertility, right? And I was like, okay, I'm here for it. I don't know. Maybe. I don't know. So I sit down, I'm talking to her. I'm being all, And when you have an infertility intake visit, it's like, okay, have you had any surgeries in your belly? Have you had any STDs? Have you had any abnormal pap smears? Have you had trauma inside your belly? Like, have you had an appendicitis or anything else like that? Okay, no. Do you have pain with intercourse? How are your periods? How often do you have sex? She goes, about twice. And I was like, so, I was trying to keep it together. So I was like, I'm sorry. Twice like a week? She goes, no, like twice a day. And girl, I mean, I had been, I just stopped typing. I looked up and this is pre-COVID, so I didn't even have a mask on. Girl, all kind of my face went to raised eyebrows and what the mother blank did she just say? So I just stopped. I needed to be clear. So I stopped what I was doing and I said, I'm sorry. Did you say you're having sex twice a day? And she said, And I said, why are you doing that? You know what she said to me? And touche. She said, and she got herself back because we was going to go there. She goes, well, why ain't you? I mean, put me in my place, girl. Put me in my place. I was like, wait a minute. Why ain't I? Wait a minute. Then I started to feel bad about myself for a second. But then I got over it. Okay, I wouldn't have had a beverage about that, but whatever. I'm in a little bit of a cobwebby vagina situation right now. So you know what I'm saying, okay, Carrie? But whatever. So I just had, so anyway, she needs to every other day because men make sperm. The whole point of that was they are reproducing sperm every day. So if you're having him shooting out something twice a day, there's like 3 little swimmers in there every time he does that. You got to give guys enough time to rebuild a couple million.
She was thinking, she was thinking that she was maybe, or he was maybe infertile because they haven't gotten pregnant yet because they're having so much sex.
Correct. She was pregnant the next month. I was like, girl, if you would just give a man a break. And when and she was young, here I am 44. And what I wanted to say was, you think that's having sex? Like, you mean he's like ejaculating? Because what I'm talking about when I say I was having an evening, it didn't take 1.5 minutes. But I didn't want to go there because I was just being ugly because I was mad that she called me out on my not twice a day sex stuff. So, I was feeling a little kind of sorry for myself. But I was like, she's young. She don't know. She ain't even getting no flowers or nothing. Nothing happened. I don't know. Girl.
So wait. She also knows that she as a woman cannot get pregnant every single day she's having sex.
This was just their normal.
No, I know, but she's not able to get pregnant every day of her cycle.
She didn't know anything.
So she didn't know that, and then she also didn't know the limitations of the sperm.
That is correct. And literally the next month called me pregnant.
Okay.
Girl, I don't know. I would have felt like I rode my Peloton for like 6 years straight if I was having sex twice a year. Because listen, that Peloton is no joke. I can't do it. That'd be hurting. That'd be hurting the sister. But anyway, okay. That's a talk for another day. But okay.
I don't even know which.
Oh, tube.
No, I don't even know where to go right now. Because I had a thought. Sorry. No, you tell me. You keep on going. Because my thoughts are blank right now.
Let me think. So we talked about how to consent a person and the things that would need to be talked about. Regret, and who's associated with highest regret. That would be younger aged people below 30 have a higher 14-year regret risk than somebody who's over 30 when they get it done. Like we talked about, people who've never had a baby before don't have higher regret than people who had children. So that's a misnomer for people. And we're not supposed to be judgy McJudgeson about what people should have. The consent should also include alternatives, and to make sure that people understand you do have alternatives that work as well as getting your tubes tied, that are not permanent and that are not as surgically invasive to you. Those would include a Mirena IUD, a Paragard IUD, intrauterine device. Those are little T's that go up inside your uterus, which I currently have my 4th one in my uterus right now. Her name is Ruby. First one was Stephanie, then Farah, then Gloria. This is Ruby. She's amazing. My daughter has one. My daughter's name is Cecilia. She's like, ooh, Cecilia's working so good. I know I'm on my period, but I'm not bleeding. That's amazing. And your pregnancy rate is as high as if I were to get my tubes tied. So I can almost guarantee you right now that as I sit here in this chair, I do not think there's another woman on this planet Earth who wants to have children less than Janae Marie Davis does. Okay. But I would never in my life go under the knife of surgery and anesthesia to have a tubal done when I can just have an IUD, because I'm not increasing my risk. I'm not increasing my risk of getting pregnant because I'm not driving around a Model T. I have an electric car right now. That's the difference. Like, an IUD was come up with not just so that we could say we came up with something amazing. We wanted to give women the opportunity to still have very high level birth control without having to go to surgery, but have it at the same level that it would be if it was permanent. Even though it doesn't make sense to you, I have personally tied someone's tubes, and I am phenomenal. And I have personally tied somebody's tubes, took out a hunk of it, looked at the pathology, segment of tube removed. And she came back to me 7 years later, pregnant.
And you took both tubes?
Correct. Mm-hmm.
Because it was still open at the top, even though...
Yep, she cannulated herself. She had herself have a little fistula, is what they're called, when some people heal. It left a little fistula hole, and her eggs somehow, by the grace of God, got in there. I had somebody who had their tubes tied twice. She came in for her C-section because she'd already had her tubes tied, and it failed. I did her second C-section. It was like a bomb had gone off in her belly, and I took the very ends of her tubes because that's all I could get. It was like super glue had been poured into her stomach. There's no way there was any space or room for anything. We could barely get the surgery done. I took out both ends of her the nice little fingers that go and reverently pull these eggs, took those out. I was like, girl, this is a hot mess in here. Shut her back up. And she came to me 8 years later, and she is pregnant currently. She's probably like 35 weeks pregnant after 2 attempts at tying her tubes. So I tell that story not to say how negligent I am or how terrible I am, but to tell people you're not guaranteed that you're not going to get pregnant. But people's grandmothers and mothers say, you better get your tubes tied or else you're going to get pregnant. But that's not true. You're getting your tubes tied doesn't make it any better for you than the other alternatives, which I know we're not here to talk about, have a contraception talk, but there's other alternatives that give you benefit, like get my period to nothing. I haven't had a real period in 11 years. I love my Mirena. It's amazing.
That was the best part about being pregnant, besides my daughter.
Mine's the Mirena.
No, I didn't have my period for 2 years total because of the pregnancy. And then now, Janae, I feel like, I was like, again? That was so fast because time just goes faster for me because I'm getting older. By the way, you say you're old. I'm older than you.
How old are you?
Me and Kelly are the same age.
Was Kelly like 32?
No. Aren't you her doctor? Don't you have a file that says her age?
Violate on people's personal information, so I will not be sharing her age. You can share your age if you want. I'm 44.
Listen, no, I'm 40. I'm 45. I turned 45 in May.
Okay, well, I think you look great.
Well, you look great too, but you say you're old. Maybe you feel that way, and I don't feel that way because my kid is really young still.
Yeah, no, girl. Mine's off at the getting ready to go to OSU Michigan game. I ain't even thinking about it.
I have a friend that I just recently saw. We're both dancers in the industry. I haven't seen her in a long time. I knew she had kids like when we were in the thick of it. I was like, hey, how's your kid? She's like, you mean my adult? Her kid's like 20.
Yeah.
And she was still at the audition with me, shaking it. So.
And good for her.
I know.
Wait, I'm taking this mirror because I told you my vagina can't take that Peloton. That hurts too bad. So I'm going to get that mirror that hangs up on my wall, and I'm going to get with my little personal trainer, girl. I'm going to get it tight. You're not even going to know me in a second. Carrie. You're going to be like, shoot, is that Janae? Dang. Yeah. She's giving
it.
Yeah.
I'm so confused how I knew none of this.
Okay. Like, yeah, that's okay. And that's the problem is that we don't talk to people about this stuff. And that's why, again, I get mad because people deserve time in their visit, right? Or else we just skate past it because we're trying to see 40, 50 people in a day. And it's just too hard to explain all that to people. And if you're seeing 50 people in a day.
Okay. Wait, this came up in my conversation from last week. One of my ladies, she just had her beautiful second baby. And she was like considering getting her tubes tied during the planned C-section. This is her second. She knows she doesn't want a third. But what got in the way was that she is Christian. She's very religious, but not Catholic. And she was going to a Catholic hospital. And they basically told her ahead of time, because she was planning this, that if she would want to get one, she'd have to have a board of ethics review decide for her whether or not they could do that. Is that common?
So yes. So no, here's the thing. So Catholic hospitals, to say they're not going to sterilize, exceptionally common. But since we came out with the ACOG recommendation to remove fallopian tubes completely for ovarian cancer reduction risk, now that is how most people at Catholic hospitals get their tubals done. We say it is an elective procedure that I am doing for cancer risk reduction instead of for sterilization, and then they can get it done. Because most of the doctors at those hospitals who have privileges at those hospitals are not Catholic, and they do want to do their tubal. The hospital does not allow it. But now that we can do it for cancer risk reduction, most people can get it done.
Oh my God.
And you don't want to get me started on that either. Because
Janae, actually, I text Janae all the time. And I'm like, whatever the topic is, I'm like, can I get you to talk about this? She's like, let's pass on that. Let's talk about this.
Yeah. Hashtag boundaries. I got booted out of therapy. Not booted. I graduated out of therapy. She's like, your boundaries are so good. I'm like, girl, I'm trying. Okay. I got to protect my peace, y'all.
That does not mean that Carrie Podcaster is not going to just keep on asking.
That's fine. Because I'll become peaceful about it one day. And then I can't wait to talk about whatever you want to talk about.
I would love to also bring you back on in 2023 about contraception, because I've never actually, we haven't done that topic. I'm realizing, like, I was like, oh, you know, like I don't plan for these things. I just have you meet me on the Zoom and we just talk. And I'm like, how much can we talk about a tube tie? And then it's like, oh my God, it's just so much. So like,
Well, let's talk. Okay, since we are supposed to be talking about tube tie, let's talk about what is the risk of getting your tube tied. Why doesn't everybody just do it? Like, stop being so dramatic, Janae. I'm done having babies. Just go in there real quick, snip, snip, and be done with it. I'm done. Okay, well, let's talk about why alternative forms of birth control are safer for people.
Yes,
and why
that would very good thinking.
Okay, there we go. So when we talk about the risk of regret, risk of all that stuff, that's one thing. But then we have to talk about the surgical actual procedure. If you are having a scheduled, planned C-section, the risk to you is hardly any, because I already opened your stomach up. I am already holding your uterus in my hand. I am looking directly with my hands at your fallopian tubes. I use a small device that looks like scissors and it's electric. Zoop, and I just zoop your tube off. And literally it takes 1 minute per tube to get off. Your recovery afterwards is exactly the same. You feel zero pain difference because I took your tubes out or you didn't. Your bleeding risk is as long as we tied or burned your stuff where we were supposed to, and it's really not a difficult procedure at all, you should be fine. Like, it's not that risky to do.
Like that opening, you burn it closed? Where you cut it? If you think
about oh, here we go. So, because I love visuals, right? I'm all about the visual. So if you took both of your arms and you stuck them straight out to the sides and you put a towel over top of it, draped a towel over it from your wrist to your underpit, right? You just drape that towel over there. Your arm is your fallopian tube, and that towel that's just flapping down there is called the mesosalpinx. There's hardly any blood vessels in it. There's like 2. But it's kind of like a filmy saran wrap that just holds your tubes from floating all over America. It just kind of attaches it to the side of your uterus. So we just take this there's hardly any blood vessels in it. We just go right up by your armpit and go bzz, 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 down to your wrist. And that little towel just, it goes off. And then I take my arm and I throw it in the jar, and that's my fallopian tube. Does that make sense? Like, it's just separating your arm from the rest of the towel, but there's not a lot of tissue there. You can see straight through it. Like, if I stuck my finger on it, I can just look right there and see my finger. There's hardly any blood vessels in it. It's just a little sheet of nothingness that is really, really, really easy to deal with. It's not that risky.
Okay.
I shouldn't say that because I'd be like, oh, yeah, it's the hardest thing ever, girl. We been there sweating. No, we ain't. Girl, my Bruno Mars is on when I'm doing that tubal. I'm not even thinking about that tubal. I've got my little...
Okay, wait, just a tangent. Have you changed your playlist since I talked to you?
I did have to, because you're not going to believe it. My Mariah Carey just burnt out. We were old school discing it. We were old school CD discing it. And I think I've listened to the same Mariah Carey and Bruno Mars CD for literally 8 years. And so, yeah. So now I'm on just Pandora, and I tell the person, what kind of music do you like? And we just hit the Pandora.
Okay, so you changed your playlist. Okay, so...
Which was unfortunate, because my 34-minute C-section, that was exactly when that song was so good for me.
Timed.
But again, girl, I've been meditating. I'm in mindfulness-based stress reduction class. I did 8 weeks of it. Now I can get through it. I'm all right. I did some deep breathing on that. Mm-hmm.
Okay. So risks. Okay, so...
Yeah. Okay. So there's that risk. Hardly any. Then if you're doing a postpartum tubal. So let's say, okay, I just had my baby. My uterus is at the level of my belly button. I cannot throw up into my mouth. So anesthesia will not put me to sleep. They're going to redose my epidural, or they're going to stick a needle in my back and do a spinal. So I'm still awake, but I can't feel anything from about my belly button down. I can feel pressure, but I can't feel anything. Because I still have that bump right there at my belly button, which is my uterus. My doctor, Janae, or whoever, is going to take an incision and make it about 2 centimeters right below my belly button in a smiley face. They're going to make a hole in there that they can actually get about 2 to 3 fingers in there. And they're going to reach in there with their finger and push my uterus until they can get to my fallopian tube. They're going to pull my fallopian tube up through that hole. Mm-hmm. Up through that hole, because that's how high it is. That's how high the uterus is, that I can get to it. And the uterus is pretty tip-toppy because the baby just came out of it. And I go zoop, and I just burn the fallopian tube off that way through that hole. And then I let go of it, and it goes whoop, right back into the belly. And then I sew that smiley face back up again. That is slightly more risky than doing it when I'm looking directly at it, because I'm working through a 3-inch hole, right? I'm not looking at it with my hands where I can get to it really easily. So that's a second way to get it done. But you have a bigger scar on your belly. You have like a smiley face underneath your belly button. And I don't think it's vain that people don't want incisions all over their belly. You know what I mean? If that's not what they want, then we can't poke right in the middle of their belly button. They're going to have a scar there. And some women don't like that, so that would be a downfall to that. Second, the not great thing is that it feels like somebody hit you in the stomach with a bat. But guess what? I just had a baby. Like, so now you want me to try to nurse my baby or pick my baby up or hold my baby. And feels like somebody hit me in my belly button with a bat right there. But for a lot of women, getting it done right at the time that they had their baby affords them the recovery during their 6 weeks time off work, or 2 weeks, because some jobs don't give them that much time. Don't get me started. It affords them to have that procedure done while they're still recovering from something else. So they don't have to take more time off work later to get it done another kind of way. Does that make sense? Yeah. So there's that way. Then the third way would be the laparoscopic way. So after at least 8 weeks, when the hormones have gotten out of my body so that I'm not increased risk for vomiting and sucking it back into my throat, then I can get put all the way to sleep with a tube that goes down my throat. Because when Dr. Janae pokes a hole in my belly button and puts gas into it to blow my belly button up like a snow globe so that she can see what's happening in there, as that pressure to elevate my belly gets bigger, 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 it's also pressing on my diaphragm, right? So it's going to push up on my diaphragm so that it can snow globe itself out so I can see. Does that all make sense? If I make my belly into a snow globe and I'm pushing up on my diaphragm, the opposite of pushing up on my diaphragm is me breathing down with my lungs. When I take a breath in my mouth, I'm expanding my lungs and pushing down on my diaphragm, right? Yeah. So when we go against that, a person who's asleep does not have enough strength to go against what I'm doing with my snow globe pressure. So we have to put a tube down their throat and blow air into their lungs for them so that we can breathe for them because they're under that anesthesia. Does that make sense?
Yes. Okay.
That is why I will not, and not to say that anybody else shouldn't, that is the difference between, for me, of going through surgery inside of your belly. That's what I meant when I said inside of your belly. I have to put a tube down your throat and blow air into your lungs for you to counteract the pressure of me making a snow globe in your belly. Does anything typically happen with that? No, it's really not risky, but I don't want the risk at all.
Right.
The second risk that you have is when I'm going to poke into your belly button, I'm doing that blindly. So I make a little tiny nick incision right in the middle of your belly button. Well, I make it in the middle of your belly button. Other people make it maybe slightly below, slightly above, or otherwise, but I like cosmetically to hide it that way. So that's where I do it. And any of them are fine. When you poke into somebody's belly button, you do that blindly. You do not know what's right underneath somebody's belly button. Their bowel could be there. Their omentum, which is the fat that covers the bowel, could be there. They could have some aberrant blood vessel that runs there that we don't know about. So back in the old days, we would poke into it with a blade, and mother of God, like, yikes, we could slice your bowel. Nowadays, we use plastic trocars that have a little bit of a sharpness to them, but your risk for bowel injury is a lot less. It goes up if you're like, yeah, I had my gallbladder taken out and they already poked through my belly button. And I had my appendix taken out and they already poked through my belly button. And every time somebody has a surgery done through that space, it makes it more and more sticky. So the next time you go back through there, you have a higher and higher chance that bowel is sitting there or omentum is sitting there. If somebody hits or nicks your bowel when they're going into your stomach, you have to have a general surgeon come in, run your bowel, and possibly take out a portion of your bowel. That's a big risk. The second thing, once I'm inside
you're talking about small intestine.
Great.
You're talking about the small intestine.
Talking about the small intestine, because your large intestine isn't in that space. It's somewhere else. Once you poke into those two bottom ports that go in the bottom parts, a little bit inside from your hips, then you're using electrocautery. You're using, which is like little burning agent so that we can burn these tubes out. But there are other organs that are down there that are close to your fallopian tubes. Your ovaries aren't attached to, but are close to. The bowel moves underneath when I pick your fallopian tube up. The ureter, which is the tube that goes from your kidney down to your bladder, and the big blood vessels that are on the sides of your uterus are all potentially able to be harmed whenever we are working in that space to try to, with little chopstick thingies, get these fallopian tubes out. So all of those are at risk. You're at risk for bleeding, that we didn't see it, injury to something inside your belly, in which case, if it's injured, we might have to open your stomach up and fix it And then you might need to stay in the hospital for a day or two. Does that happen very often? Absolutely not. Does not happen very often at all. Have people passed away from a tubal? Absolutely. They've died from getting a tubal when you go to put the trocar and hit a vessel that nobody knew was there because you couldn't see it. People have lost their life doing it. So again, Model T, right? What can I do to still get
the same effect?
As good of a result of not having I do not want to have a child, but I don't want to go through the risk. I don't have any more risk of getting pregnant than anybody else who had their tubes tied. I just happen to have an IUD that I can change out every 8 years in the office with no surgery, 2 shots of Crown before I got that put in. But that's just me. I don't know if y'all take it pain a little better than me. But I don't have to worry about it any more than anybody else who had their tubes tied. It just makes it so that people can't change their mind if they get their tubes tied.
Okay, last question. Yeah,
I can't wait.
So you see a lot of women. Yeah, you see women all the time. Is there like a cultural thing around contraception versus tubes tied? Like, you know what I'm saying? Like,
yes, it's cultural. The older people do not believe that you can still get the same effect from contraception that you can get from permanent sterilization. Second, a lot of people were worried about their insurance running out. So from an economic standpoint, they were like, I cannot afford it. I cannot afford to have another kid. And someone in their history, in their life, and their grandma, their mom said, this is the way not to do it, is to permanently do this. So I cannot change my mind. I never wanted this, can't change my mind. It's hard sometimes when people don't believe you. They're like, I do not ever want another child. So I'm so serious that I'm going to do something permanent. But that does not mean that you're any more serious than I am. Because as I said, there is nobody who don't want a baby coming out of their uterus or vagina more than Janae Marie Davis of Heath, Ohio. Okay. So it's just hard because people are still talking to people who are still driving around a Model T. Do you know what I mean? And so I really work hard on the education portion of it because it's not necessary to go through anesthesia and potential surgical risk of bleeding or injury to your bowel or something inside of your abdomen when you can have the same effect without having a cycle, without having a period or having a really light period with an IUD and have the same effect. It's not necessary. And if after that conversation, people say, I hear you, Janae, but I still want to do it, I'm totally down for it. I'm like, I can't wait to sign you up. I have to make sure that I did my due diligence, telling you all this information. And then people, should be given the opportunity to make the decision that works best for them. And that's fine.
Okay. Sorry, I lied. One more question. When you have your tubes tied, are you still getting a period?
Yes, your fallopian tubes have absolutely nothing to do with your cycle whatsoever. They are pieces of tissue that just carry that loving, reverent, feather-like hair.
Okay, but the egg is not making it into the uterus, but the uterus lining still sheds itself monthly, no matter what, until you are
correct.
What's the word?
Menopause.
Yes.
Unless you have a contraceptive like Ruby that works by disrupting and suppressing my endometrial lining. My IUD makes it so that I don't grow a lining, so that there is not a nice fluffy spot for an egg and sperm to implant into. So even if an egg and sperm got together, which every month I still ovulate, girl, I can tell when I'm ovulating. My face break out like I'm 17 years old. My little mustache be growing. I'm like, doggone it, my mustache is growing. Thank God for the mask, girl, because I done had some whiskers coming up. You wouldn't have believed it. I take my mask off like, praise Jesus. Nobody saw this. Lord have mercy. I mean, like, But I still ovulate every single month. Now, for me, my cycles were 24 to 26 days apart. It was terrible. I used to bleed like to beat the band, like 10 heavy, clotty days. I have not had a cycle in 11 years, and my baby's 11. I put it in my IUD in right after I had her. I haven't had a period in 11 years because it's the way that it works for birth control is to get rid of your lining. And it actually decreases my uterine cancer risk because I'm not growing a lining. So an IUD works differently. You will still ovulate. Every month. It just doesn't have anywhere to implant.
I had no idea. So the women who had their tubes tied, they're still having tampons and pads and everything.
100%. And here's the problem too. And here we go. They're like, somebody did something to me because now my cycles are horrible now that I got my tubes. I'm like, girl, please, you've been on birth control pills that were tricking your body into thinking that you were pregnant. So you never had a real cycle. That was never your cycle. That was a synthetic, made up hormonal cycle that I gave you. But I can give birth control to a 70-year-old and make that person start having a period if I want to. So that's not their cycle. When they get their tubes tied, they get off all birth control because they're like, hallelujah, I don't need to worry about it anymore. Now your cycle, mama, might be every 27 to 35 days, and you're sitting at Olive Garden, you start bleeding because who knows where, because it used to be 2:00 on Tuesday, right whenever I start my cycle. Let me put my pad on because it's 1:00. That's how cycle you were on a pill. And now you're not. So you're pissed off because you don't know when your period's going to start. And it's heavier than all hell because you're not on a pill that's tricking your body into thinking that you're already pregnant. So people think the tubal did something to them hormonally, and it didn't do one GD thing to you hormonally. You're just being your normal self again. So there's a ton of people who get their tubes tied, and guess what they end up getting right afterwards within 3 months? Wait for it. A birth control pill or an IUD because they hate their cycle, which is why I tell them, you sure you want your cycle back, girl? You sure you want to do this and get your... Yeah, girl. Okay. I'll see you in 3 months. And then they come back in 3 months. I can't pay for these pads and tampons, these menstrual cups. I'm like, I told you this was going to happen, but I'm happy to give you your pills back that we are doing for cycle control, not for pregnancy because your tubes are tight. Correct. Mind blown, Carrie.
I didn't know any of this. Zero.
We should probably have a contraception talk then, because this is important for women.
I didn't know this. Okay, so Dr. Janae, we're gonna wrap this topic, and then we're gonna get on the phone again after the new year.
Okay, sure.
And talk about contraception. And I'm just gonna wait until all the other topics that are really sensitive right now start to settle, and we'll get it next year sometime.
Okay, I'll be there. I'll be there probably in a year. I'll be there.
I'm patient. It's okay.
That's fine. Okay.
I'm patient.
And we got all kinds to talk about. The female body, everything about females is so dynamic and fantastic. We could talk for the rest of our lives about how amazing we are. So I'm happy to do it. I'm here for it.
Dr. Janae, you light up my life, and hopefully everyone else's that gets to listen to you talk about these very serious things, but in a way that we can understand and laugh and also get the information. So appreciate you. My listeners, thanks so much for tuning in today. In the show notes, there is links to Roll It Out Myofascial Release class, and you can get the free 3-part series on aerial rehab now on my website. Check there. Thanks to Asa Watkins, sound engineer, best baby daddy ever. And, please honor me with a 5-star and a review anywhere you get your podcast. And if you're in the Apple podcast, so easy to just click 5 stars and, just leave a sentence. I'll highlight you on my website. I will thank you forever in my heart because it makes a huge deal. It's very important for me to get new listeners. So, all right, guys, this is the Expecting Aerials podcast, now part of the Digit family of podcasts. Thank you so much for being here. Over and out. See you guys next time.